Hello, everyone, and welcome to this audio podcast. This audio podcast on behalf of the Renal Patient Support Group, the RPSG. Where this audio podcast we'll look at works that form part of a research poster presentation at the IBMS Congress in around 2015. The theme was in around immunology, but where immunology was linked to nephrology or kidney care. The research poster presentation works looking at nephrotoxic nephritis or NTN and glomerulonephritis, and animal model versus human disease, and where this works was a review. The and there was in around this research poster presentation, there was a publication, a peer-reviewed publication that was published in around 2015, around 2015, in a biomedical science in a biomedical science journal in a biomedical science journal. So this research poster presentation will look at nephrotoxic nephritis, NTN, and glomerulonephritis animal model versus human disease in as a review, sort of a review, of the of both sort of nephrotoxic nephritis as a sort of biomarker, but also glomerulonephritis. The research poster presentation will look at sort of introduction epidemiology, and look at the aims and objectives, pathogenesis, animal models, looking at animal models and looking at animal models in context of laboratory investigations, and then looking at the role of chemokines, and look at sort of treatments, and then draw on some conclusions. So listeners and viewers, that would be the theme in around the overview of this particular research poster presentation. My name is Shahid Nazir Mohammed, and this is an overview of this works. So, as part of the introduction, then the terminology glomerulonephritis encompasses a range of immune-mediated disorders that cause inflammation within the glomerulus, and other compartments of the kidney. The mechanisms of interactions between these cells and mediators, and the mediators of coordinated response to inflammation, to inflammation, which and where inflammation is elucidated. Despite, however, these pathophysiological advances, treatments for glomerulonephritis in majority remain non-specific, hazardous, somewhat hazardous, and only partly successful. Glomerulonephritis therefore remains a sort of common cause of forms a common cause of chronic kidney disease globally. So animal model approaches offer effective and safer treatments offer effective and safer treatments. Evidence of complement deposition, that is complement in context of the immune, as part of the immune response. So evidence of complement deposition with glomeruli is a sort of main feature of many forms of glomerulonephritis, and the role of complement is implied is implied by several observations in human disease. Indirect evidence obtained from human investigation has been supported by findings in animal investigations. The mechanisms by which macrophages mediate renal injury or kidney injury remains to be confirmed. Remains to be confirmed in in sort of in sort of specific forms of glomerulonephritis, and but it is likely to include sort of a promotion of inflammation through a release of pro-inflammatory cytokines such as tumor necrosis factor, recruitment of macrophages and other leukocytes through a release of chemotactic molecules such as monocyte chemotactic protein 1 or MCP1, cell proliferation by release of growth factors such as macrophage colony stimulating factor or MCSF, cell death through the release of reactive oxygen species. So the aims. So before going into the aims and objectives, listeners and viewers, a little bit around the epidemiology. So many cases of glomerulonephritis resulted in mild asymptomatic illnesses that is or are not recognized that are not recognized and remain and sort of undiagnosed. The incidence and prevalence of such mild episodes of glomerulonephritis are unknown, but could be substantial. In the United Kingdom, for example, the most common recorded renal diagnosis is glomerulonephritis, where it's biopsy proven, biopsy proven versus non-biopsy proven in around 19%, followed by uncertain being 18%. And for all ages, and bear in mind, listeners and viewers, glomerulonephritis is not restricted to the adult population or the geriatric population. It is pathogenesis and pathophysiological detriment that can occur in pediatrics and young people. So for all ages, the prevalence rate in males exceeds that the prevalence rate in males exceeds that in females, peaking in the age group around the age population between 75 and 79 years at 2,918 per million population in males, and for females the peak is in age population around 65 to 69 years at 1,460 per million population. Population-based screening studies or investigations have shown that incidence of kidney damage by proteinuria, hematuria, low calculated glomerular filtration rate, or a combination of these features is present in around 16% of adults in, for example, in adults, for example, again in Australia. And a similar proportion in the United States. In the United States, accurate classification requires a histological diagnosis. Consequently, the reported prevalence might vary according to local indications for renal biopsy. An investigation of all renal biopsies or kidney biopsies done in the Australian state of Victoria during 1995 and 1997 found that just over 21 people per 100,000 population per year underwent renal biopsy, yielding a yearly incidence of biopsy-proven glomerulonephritis of just over 12 per 100,000. The most commonly diagnosed types of glomerulonephritis in adults IgA nephropathy and focal and segmental glomerulosclerosis and vasculitis. Those most commonly diagnosed in children or pediatrics and young people were minimal change disease, focal and segmental glomerulosclerosis, lupus nephritis, and IgA nephropathy. So now looking at sort of the aims and objectives as part of this research poster presentation, where this research poster presentation was a review. So research with animal models have shown a crucial interaction between inflammatory cells and cells intrinsic to the kidney that is both or are both fundamental and unique to the pathogenesis of glomerulonephritis. The objective of this article, of this works at the time, was to provide an insight on a suitable laboratory sort of laboratory sort of laboratory sorry laboratory equivalent sorry laboratory disease the laboratory disease based model a laboratory disease based model nephrotoxic nephritis and glomerulonephritis, inolactic nephrotoxic nephritis and glomerulonephritis, and relate the experimental investigations and validity amongst human disease. Around the pathogenesis, then, the pathogenesis of glomerulonephritis is complex. Intricacy arises from several factors such as autoimmunity, cancer, and structural abnormalities within the kidney. And there is variability in the susceptibility to glomerulonephritis, which is likely to have a genetic basis. And there are also complex interactions between soluble factors including antibodies, complement chemokines, cytokines, and growth factors, and cells, both leukocytes and intrinsic kidney cells or renal cells that mediate glomerular inflammation. The contribution of non-specific factors such as abnormal arterial blood pressure and proteinuria promote continuing renal damage despite resolution of the initial insult. A constant feature of GN or glomerulonephritis is also the presence of inflammatory leukocytes within both the glomerular and the interstitial compartments of the kidney. Macrophages and T lymphocytes are the dominant cell types present, and intensity of cellular accumulation, particularly within the interstitium, rather than the glomerulus, has repeatedly been found to correlate with the clinical and pathological severity of disease in animal models and in human beings. Within the kidney, T cells and macrophages undergo activation, which are triggered by interactions between leukocytes and intrinsic renal cells, and by interactions between cells and matrix, and by cytokines and other soluble factors present within the inflammatory environment. Type 3 hypersensitivity occurs with antigens and antibodies present in roughly equal amounts, causing extensive cross-linking. It is characterized by soluble antigens that are not bound to cell surfaces. In the case of for example, in the case of type 2 hypersensitivity, and when these antigens bind antibodies, large immune complexes from that cannot be excised. The reaction can take hours, days, or even weeks to develop. Type 3 hypersensitivity represents the progressive forms of glomerular nephritis, or GN. So looking at animal models, laboratory animal investigations, or animal models in context of in context, sorry, of glomerular nephritis and nephrotoxic nephritis. So, an animal model, or a laboratory model, an animal laboratory investigation, or animal model is used. It tends to be used during research and investigations of human diseases. The animal selected will usually meet a determined taxonomic equivalency to humans as to react to disease or its treatment in a way that resembles human physiology as required. Research relating to NTN, or NTN, nephrotoxic nephritis, glomerular nephritis, can be traced back to the 1960s and late 1970s, when the investigations reported observations on the role of complement in nephrotoxic nephritis, which produced in rat laboratory investigations, but also additionally in rabbit and duck nephrotoxic sera. In contrast to commonly used animal investigations of immune complex mediated nephrotoxic nephritis, glomerular nephritis, the BALB murine model, or mice model have been highly reproducible and require short-term injections of lipopolysaccharide. The BALB-C nephrotoxic nephritis murine or mice model still has a sort of experimental validity in the study of glomerular nephritis in humans. In addition, the BALB-C model can still can be helpful in the investigation of glomerular nephritis and the link between glomerular nephritis and the autoimmune phenomena. Duplicating in features of human glomerular nephritis have provided insights into the pathogenesis, the reproducibility and uniformity of such animal investigations have permitted a sort of step-by-step dissection of many of the mechanisms involved. So now looking at the role of chemokines, and sort of bear in mind, listeners and viewers, that the chemokines or chemokine receptors, for example, tend to be sort of research that focus primarily in aspects of, pertaining to sort of transplant rejection. However, in some published works, there is basis in around sort of a role of chemokines in around nephrotoxic nephritis and glomerular nephritis. So it is now to be appreciated that when the glomeruli damaged by inflammation, growth factors are filtered into urine, where they activate renal tubular cells, thereby causing them to secrete chemokines and cytokines. Intriguingly, one team had generated CXCR3 deficient murine or mice models to investigate the functional role of CXCR3 in the kidney under pathological conditions. NTN, nephrotoxic nephritis, was induced to analyze the molecular mechanisms of T cell recruitment in glomerular nephritis by CXCR3 and its three ligands, three ligands being IP10, CXCL10, IP10 being chemotactic for CXCL10, MIG or MIG being chemotactic to CXCL9, and ITAC being chemotactic for CXCL11, and to identify potential novel targets for therapeutic or pharmacotherapy interventions. The research had identified that chemokine receptor CXCR3 mediates renal T cell recruitment and subsequent tissue injury in nephrotoxic nephritis. The investigation provided a sort of rationale for considering CXCR3 blockade in T helper type 1 mediated renal inflammation as a future or prospective therapeutic option for recipients or patients with glomerulonephritis and glomerulonephritis subsets. Now looking at sort of the treatment, some of the treatment aspects. So regular clinical follow-up, regular or routine clinical follow-up, arterial blood pressure monitoring, and the use of angiotensin converting enzyme inhibitors in recipients with for example, proteinuria exceeding 1 gram daily, is advantageous. Has been documented evidence as being advantageous. Being documented as and evidence as being advantageous. Findings also have suggested that more complete blockade of the renin-angiotensin system by use of both by an angioconverting enzyme inhibitor and angiotensin receptor antagonist is superior to either agent or pharmacotherapeutics or pharmacotherapy alone for prevention of progressive glomerulonephritis amongst recipients with proteinuria. Also has treatment of other relating of pharmacotherapeutics have also slowed progression in experimental models of glomerulonephritis, but available trial available trial data are insufficient to be used as recommendations specifically for renal protection. Currently used IST or immunosuppression therapies for human glomerulonephritis are not always uniformly effective and frequently associated with serious side effects. Corticosteroids are effective in several types of GN or glomerulonephritis, owing to the ability to inhibit the pro-inflammatory effects of cytokines known to promote glomerular inflammation, including interleukin 1 beta or IL-1 beta and tubular necrosis factor alpha, TNF alpha. So now looking at sort of the conclusions around this research poster presentation. So the objective of the works was to provide an insight on looking at the importance of a sort of identifiable glomerulonephritis, a nephrotoxic nephritis model, and relate its experimental validity in humans. Animal with experimental nephrotoxic nephritis, glomerulonephritis are homogeneous, whereas recipients with glomerulonephritis are heterogeneous. Experimental disease is initiated at a time determined by an investigator and runs a predictable basis, thereby permitting intervention at defined stages, including before induction, during disease establishment, or late or late or later in investigations. Recipients are typically that have established disease before treatment, disease treatment tends to be given. Treatment tends to be administered or prescribed sort of before before sort of beforehand. And renal damage tends to be progressive in the longer term, despite elimination of the original source of injury. Hence why listeners and viewers in around listening on this research poster presentation is why acute kidney injury, AKI, has been a big remit in around the sort of developed world, and the developed world in around where kidney or renal disease is concerned. Differences between experimental and human glomerulonephritis complicate translation of experimental therapies or pharmacotherapies in practice. Stem cell-based therapies or treatments can be explored or investigated, and these could include a genetic modification to produce protective molecules within the kidney, or to promote regeneration of damaged intrinsic kidney cells. There is a requirement for more up-to-date research on this topic, and further work is required to translate animal model research to better comprehend glomerulonephritis disease in humans. The complexity of GN research, however, is the complexity of glomerulonephritis, however, is where research makes findings a challenge to replicate more consistently. Finally, there must be a sort of continuing evidence-based assessment of immune and non-immune pharmacotherapies to direct rational care for patients. This has been a research poster presentation looking at nephrotoxic nephritis and glomerulonephritis, animal model versus human disease, as sort of a review, and where this research poster presentation was works that have been presented at the IBMS in 2015, and those who are interested in looking at the aspects around nephrotoxic nephritis and sort of laboratory investigations, there's works that have been published in the British Journal of Biomedical Sciences in 2014, and the publication by Mohammed in 2014, looking at nephrotoxic nephritis and glomerulonephritis animal model versus human disease. And there are citations or references in the publication. Thank you.